Black women over 40. If you want to retire early, healthcare is something you just cannot skip. We've been talking early retirement, but today we're covering the parts that nobody's explaining enough about, which is healthcare. This video is not to scare you. It's to help you plan. I will be breaking down healthcare gaps, the costs to think about, and how to build this in your retirement plan. So ladies, why is healthcare so important? And why does it matter so much in early retirement? Why? Why does it matter so much? Why does it matter so much in early retirement? Why do we have to think about this? I know for me, let me tell you something. I have been knocked off my feet with this whole retirement thing because this is also a learning experience for me. I'm learning, you're learning, we learn this together. Some of us already know. So whatever you know, go ahead, leave it in the comments, And if you are enjoying these type of conversations and you are a Black woman over 40, which I know you are, go ahead, like, comment, and subscribe. Hang out with your girl. Hype the video up. And also, if you know another Black woman over 40 who's not aware of our community, share this so she can be up on this conversation. Because, you never know what people know. We don't know. But nevertheless, why healthcare matters so much in early retirement. Early retirement sounds really, really good until you realize your employer's healthcare is going to end. Healthcare isn't just one bill. For many of us, it can be the biggest bill, depending on your health needs and things of that nature. It depends on what you have going on. Because, sometimes we just get things that happen to us and it can cost. I think about diabetes, insulin, pills, those who might be on dialysis. These are different things that you go through in life. And you have to incorporate that in your healthcare. I'm not talking about the average person who's just, really, really good, maybe on a pressure pill or two, and, you're just going to get your medicine, you getting generic, and, we're really talking about how when you have serious conditions, serious elements, serious illnesses, how that can definitely be the biggest bill because you're paying out so many other things that your insurance might be paying for, but you might pay for it yourself. So it's a catch-22, but let's just keep going. Premiums are one price, but you also have deductibles, prescriptions, visits, tests, dental, vision. And this is why some people feel they're not ready to retire and they begin to panic. And they're like, hey, I can't leave this job. I can't leave it because I need my insurance. I got all these things going on. I need this. God forbid something happens. And then we sit and we live our life on God forbid. I can't do that. I don't want to do that. If I can help it, I don't want to live my life on God forbid. And then you sit back and nothing happens and you could have went and retired and you could have been living your life. And now you wait till you're 66, 67, 65 because you want to wait till you get the Medicare. Girl, but we're going to talk about it because I'm getting personal now. I'm getting frustrated. That's what it is. The before Medicare gap. There may be a period where you leave your job before your actual Medicare benefits can actually kick in. Because sometimes people retire at 62. For those who in their 50s, 55, 59 and a half, so forth and so on. But a lot of people retire at 62 and they just sit back and they say, we're just going to hang on to these next 2 years and we'll just wait till Medicare kick in and then we just pay and go from there. Yes, there is. You know what? I always keep mentioning about how you can put your healthcare expenses on your taxes. But however, there is a caveat to that. It has to be a certain threshold. Okay. So there has to be a certain amount of expenses that you accumulate. I think it's like 15,000. So that's when you're like on the self-pay realm of things and you can put that on your taxes.'t quote me. This is informational purposes only. I am not a financial advisor, but you can definitely do it because I know, my mom was doing it at one point before everything had kicked in and it definitely helped out. So that's when you're doing things, my mother was fortunate. I mentioned before about 1199. A lot of you knew about 1199. 1199 is still around, still strong and all the things. So that's where she gets her pension from. So yes, they're still around. I had to do my thing. And, when you have that gap in between before Medicare kicks in, yes, your insurance will pay for certain things, but yes, you still might have deductibles, still might have other things. And If those things add up to, I think, 15,000, not 1,500, 15,000, you can put all those expenses on a itemized sheet on your taxes. For you tax folks out there, chime in if you want to. Let the people know I'm not a tax person. I just know a little bit, just a little bit. And I might be wrong, but I know you can do something when it comes to your health care. So back to what I was saying, how there will be a period if you retire early from when your Medicare kicks in, or when you're actually eligible. That plan needs planning, not guessing. And that's where many early retirees plan falls apart. They think they have it all, ironed out, and the next thing you know, it's not ironed out. And then sometimes people get denied for whatever reasons and so forth and so on. So you gotta plan accordingly and make sure that you are within range. Because some people, they might do like a semi-retirement, but yet they might be making over a certain threshold, and then the next thing, they're not even eligible for something. So you gotta pay attention. It's a lot to this. I did not know this. It's a lot to this. So if you early retire, you're not just, replacing or reconfiguring your paycheck, you're also refiguring your benefits in regards to healthcare, vision, dental, and things of that nature. So that's why healthcare has to be your first exit strategy when you're thinking about retiring. How am I going to have my healthcare before my actual Medicare kick in, if that is a factor for you? Please let me know if you want me to do a video on if you retire early and you don't have health insurance and how that might look in regards to being a self-pay patient and things like that. For those of you who don't have too many elements going on and you go to the doctor for your physical once a year, you may go for a cold throughout the year, you go get your eyes checked once a year, you go to your dental twice a year. You're not really utilizing your benefits on a monthly basis, how if somebody else who might have a little bit more illnesses going on, how that might look. Because I think about that. I think about that right now. Like, I spend over $400 a month on my benefits out my paycheck. I'm not going to the doctor every day. I'm not going to the doctor once a month. I'm not going to the doctor every other, but right now I am. So it's coming in handy. We will elaborate on that later. But prior to, I want to say the last 5 years, I was not going to the doctor. I was just going when I needed to go on my scheduled annual visits. If I got a little cold, a little stuffy, or things like that. That's when I would go. So I was sitting here like, okay, Kelly, you're spending $400 a month. Times that by 12. If you're just paying for what you need on a self-pay basis once a year, I think an average doctor visit is like $150. And then if you add labs, or that might even be with labs. And if you add labs, if it's maybe $75, that still is not even nowhere near what you would pay on a monthly basis. And even if you get prescriptions, you're like, oh, I need my prescriptions, I need my pressure pill, I need my this, I need my cholesterol pill, I need all my stuff. Okay, fine. Sometimes when you get generic, you might pay a low copay of $5, might pay this. There are prescription plans that you can pay for on the side. There's so many different things. And I know I need to not be so off left with my conversations, but there's so much out there. Let me tell you something. I am sitting here and I'm like really, really knee deep into this retirement thing because we get so caught up in these deaths, the fear of leaving, putting up with toxic management, toxic managers, because they're going through something in their life. Meanwhile, your job is easy breezy. It's just so much I think about. But let's carry on. What healthcare costs should you actually plan for? I hope I didn't jump ahead as I did. Monthly premium costs, deductibles and out of pocket, prescriptions, doctor visits, or your specialists, because that's going to cost you more. We all know if you have your insurance, you might have your PCP. Some of us may have zero copay. Some of us may have maybe a $10, depending on what kind of plan you have, $5, $15, whatever. But specialists may be 45, 60, depending on, what that might be. I remember when I had got my hysterectomy, I went to an actual, she was what the heck was she? She was a gynecologist. She was a GYN, yeah. Was she an obstetrician, OB-GYN? No, she wasn't OB. She was just GYN because she actually performed my surgery. And to see her was $60. I had to see her quite a few times. I was like, when is this going to be over? That's why I'm happy I got major surgeries done. But even if you do have to get a major surgery done, I know for me, when I got my hysterectomy done, my deductible was $5,000. It was a little over $5,000. The anesthesia was like five, I think, if not, could have been more. And it was another fee. And I was like, but then when I went and asked about self-pay, they said, oh, it would have been different costs because of self-pay. But when you have insurance, we charge more because we know the insurance is going to pay more, and then you have your part. So you mean to my part would have been, if I was self-paid, my part would have been what the deductible part would have been, and then you would have still gave me a discount on it? Let's think about it, people. Let's think about it. We are holding ourselves back because of the system. We are. So, as I mentioned, your specialist, your dental, your vision, and any emergency buffers, surgery, something happens, things like that, or you got to go to urgent care, it might be a holiday. You just set aside for that. And you also, to try to combat all of this, try to live a healthy life if you can. Sometimes we don't even sit back and realize the things that we do that can harm us. Like every once in a while, we want something greasy. We want, go get a little smash burger or a little Shake Shack, or go somewhere, eat some barbecue or something like that, or go eat some soul food. We got macaroni and cheese, all chicken grease falling down our arm, everything. Once in a while, but when that becomes your actual diet, we're screaming, fried foods, processed foods. I love a good deli sandwich. I love a good deli, but I had to slow down. I can't eat it like that. A hero, you want to go get some sliced lunch meat, some deli meat, but I can't do it no more. I can't do it. I can't drink alcohol like I used to. I love a good cocktail. I can have one drink about this size. Wake up in the morning, I'm holding on to the wall, trying to figure out where I am, and I only had a little bit. Your body can't process it like that. I don't know what it is. As you get older, your body's like, look, can't do it. Just can't do it. I don't want my ankles swelling up and whatnot, eating too much salt. So it's like you just gotta try to live better, do better. And the more that you do better, you don't have to be in these people's offices. Use them as the just in case, but not use them as the necessity. I know easier said than done. Some of us do just have issues. Some of us are born with things like type 1 diabetes. That's hereditary. Those things are like you're born like that. Type 2 is a lifestyle. We do it to ourselves sometimes, don't even realize it. Shoot, I just got friends telling you guys in the vlog that I ate a sandwich and was hoping I didn't fall asleep. That's glucose insulin. I got to get that together. I don't want an issue. I don't. We don't judge, we listen. In saying all of this, we're not going to not build a healthcare category in our retirement and just put it as miscellaneous. We putting it in there as a major category. Housing, healthcare, light bill, healthcare. we got to. We just have to. We have to. Even if you don't have an insurance plan, or if you don't want to go buy one, there's so many other options. Understand what your local hospital, what they offering, what your local urgent care is offering, or maybe even get in their ecosystem. Play the game. I used to work at a hospital. For those of you who know Wake Med and Duke, I used to work there. I was a financial analyst there at those particular institutions or those organizations, however you want to call it, those hospitals. I shared with individuals that walked in and did not have insurance, or who had insurance and the insurance didn't want to pay for something, felt it wasn't necessary. They felt like the doctor was just trying to do too much, because that happens. Your insurance company can definitely come back and say, oh, we're not paying for this. It's not necessary. According to the records, it's not needed. There's alternatives that can be done. So then you still get your treatment done, but you just go and you go through financial assistance. I just love saying that. But even if you're healthy now, you still want to plan, because planning makes peace. And we like peace around here, especially at this age. So how to build healthcare into your retirement number? How are we doing this? Just add the line. Add the healthcare line in your expenses. I know some of us are old school. We don't want to go to an Excel spreadsheet. Some want to have a little notebook, just write it down. However that might be, add it in. That's how. But the way you add it in, you putting it in the savings category. You just put money to the side, because you just never know. Because even if you do have insurance from your employer when you get to walk away, you still gonna have. They're gonna give you what you have. They're gonna give you whatever the retirement plan is, and they still may have a deductible. It's gonna have co-pays. It's gonna still have all. So you still have to always still plan for healthcare, because you gotta still pay for stuff. And we want to estimate this, and we want to be conservative about it. Okay, because we don't want to lowball. We want to make sure that we are planning appropriately, because we don't want no hiccups. We don't want to have to dip into something else to pay for an healthcare expense. And even if the money is just sitting there, you're like, oh, I ain't been using it. Let it stay, because you never know what can happen. Again, we can't see what's inside here. We're going to get this blood work done, and we going to this doctor's office, and everything's looking fine. We're looking at our CBC. We're looking at our what was another one? Hemoglobin, all this other stuff. We're looking at all of this stuff, but you just never know what can happen. Let's leave the money sitting right there. Leave it sitting right there. So in addition to, planning, we want to revisit this line item as well, because we might have our number. We might be rocking with this number for maybe 2 years or so, but we also want to revisit it, and we may have to adjust. Maybe we have to add more, because as time goes on, things get higher. Things get higher, and we have to sit back and say, you know what? My prescription was, for the generic, the copay was $5. Now the plan done changed. It done went up to $7. Because, I know I've seen it. I go pick my mom's medicine up. So I've seen, so you have to plan accordingly. So just keep in mind, your healthcare number is not just housing and groceries and all the other little stuff that we got going on. We got to plan. We got to add it in. Sometimes we underestimate. And then when something actually happens, we get a little shaky, we get a little nervous, and we sit here questioning, hey, did I make the right decision? Did I retire too early? Should I have stayed longer? It don't matter if you stayed longer or if you retired later. If you don't plan, it don't matter. You have to plan. You got to be ready, because the same issue can still come up if you wait to 66, 65, 62. The same thing can still pop up. So you got to plan, and you got to be very realistic. So what are some ways to make early retirement more realistic? For some, semi-retirement. Don't do the full stop. Maybe you got the full-time job. You're saying, hey, I don't want to work too hard like I did. I can't put all these hours in. I want to go to part-time. If your job allows it, go to part-time. If not, maybe move around, go to a different department, different location, and have a part-time position. So they're going to probably ask, this is an HR thing, well, why do you want to not work full-time? Just say your legs hurt. I don't know. Just say something. But semi-retire. And this will, give you more flexibility, and it'll be less stress, but you still have your insurance. Build a separate healthcare fund line item. I'm repeating this for a reason, because I want you to remember this. And I'm an individual. I have to repeat things so it can stick. So I don't know if you're like that, but if I say something to myself, I write something down, and I put it on the post-it, I say it again, it's at that point, it's a part of DNA. It's part of DNA. And for some, delaying your retirement, delaying it, 6 to 12 months out to when the Medicare is actually going to kick in, if that's something that you choose to do. There's always options, so that can be an early retirement in that aspect. And I do see people do that, especially at my job. I see people, they'll hold on to like vacation and sick, don't take any of that. And then they'll use that as a buffer for them to get out early, and then they'll still be on the books getting their full paychecks. But then by the time the pension and the Social Security kick in, they have exhausted all of that. So there's ways to get around that to kind of like, do your early retirement. Early retirement doesn't have to be all or nothing. Freedom can look like part-time, consulting, remote work, or lowering your stress. Now that I'm really having these conversations, retirement can mean just not doing that 9 to 5. You can just do something else. You could say, you know what? I'm still going to work because I want to get these benefits, and I'm going to do this, and I'm going to still stack up to put into my pension or put into my Social Security. But I'm retiring from the hustle and bustle of going into the office, dealing with traffic, dealing with these inconsistent managers and their mindset, Yeah. So retirement can look different, and early retirement can look just like that. Just letting go of that, but doing something else. So I don't know. I had mentioned before about early retirement in regards to like I don't want to work. But the more I dive deep into it, part-time don't look too bad because you're still putting in, but you're not hustling and bustling. You're still enjoying the freedom of your life. And I like that. I like the sound of that. I don't have to ask you for PTO. I don't got to let you tell me, oh, it's upon my discretion. Oh, I need the department to be fully staffed just in case. Meanwhile, ain't nothing going on. This is the time you want people to take vacation because it's not the ramp up time. And then the ramp up might not even be a ramp up. I just feel like I don't want anybody controlling my life. I got the government controlling enough. You know what I mean? So why do I want my day job or my job controlling it like that? So it's something to think about. I got a little personal, okay? That's why we taking care of ourselves. I hope you enjoyed this. And I want to leave you with this. Healthcare shouldn't be the reason that you give up early retirement. It should be a reason you just plan smarter. And us black women over 40, I want to give you some encouragement. I know we sit back, us Gen Xers, because you're my generation, we have been taught from generations before us. Now, you have the silent, you got the boomers, all different things. Times is different. Some things are definitely the same, and we can definitely take some wisdom and take some encouragement. But I feel like we are in a generation now where we focus on our mental health. We focus on our well-being, where before they didn't. They took so much. And that was passed down. And I am so resistant of it. I can't take it. I just can't take it. And that's why I mentioned before, this conversations about early retirement came from my frustration. And I don't never want anybody to feel the frustration that I have, because my frustration definitely hindered my health. Okay? And hindering my health, you may sit and say, well, Kelly, now you need to stay because you need the health care. No. Financial assistance.